Aluminum foil pouch. Instructions. Pre-mixed syringe. Repair of root perforation. Repair of root resorption. Root end filling. Apical barrier/apexification. Pulp capping. Pulpotomy. Ensure hemostasis is achieved at the operative site before placing ERUD BP. Otherwise, the material may be washed out by blood, requiring replacement. Take out the aluminum foil pouch, tear it open. And remove the syringe. Unscrew the syringe/capsule cap. Gently and steadily push the plunger to extrude the required amount of material. Tighten the cap immediately after dispensing the required material. Place the material into the desired site using a sterile instrument. Then condense it. Remove excess material using a moist cotton pallet, excavator, or a disposable microbrush. After the procedure, place the entire syringe/capsule back into its pouch and seal it. Store in a dry place at room temperature to prevent moisture exposure. Before storage, wipe and disinfect the external surface of the syringe and the syringe cap after it is tightened to reduce the risk of cross-contamination.